And I just want to make sure that I restart our recording. All right. Before I introduce to you Dr. Teresa Ryan. Teresa is a physical therapist who has worked in a variety of settings, including home health care. Uh-oh, she started sharing and my screen went away. Hold on. Okay. She has worked in a variety of settings, including home health care, acute care, subacute care, and outpatient. Teresa graduated from physical therapy school from State University of New York at Stony Brook and has gone on to obtain a doctorate in physical therapy. She is currently working in the outpatient neurological area at Tallahassee Memorial Healthcare and specializes in vestibular or inner ear, dizziness, falls, and balance therapy, as well as any neurological concern. So welcome, Teresa, and take it away.
Good afternoon, everybody. Again, my name's Teresa Ryan, and I'm a physical therapist here at TMH with a passion for helping to prevent falls. So we're going to talk today about what can be done to prevent falls, both in patients with and without dementias and other Alzheimer-related diseases. So why are we going to talk about this? We're going to make sure that you can identify at least 5 risk factors for falls, recognize different fall hazards in the home and the community, and then identify at least 5 different things you can do to prevent falls at home. So falls among older adults are a very large problem. At least 1/3 of adults over the age of 65 fall every year. And falls are the leading cause of both fatal and non-fatal injuries among Florida residents, as well as residents throughout the nation, age 65 and older. And this has been true for many years, at least a good 6 or 7 years. You can find falls being the largest reason for adult injuries. So what happens when you fall? Sometimes you just get up and shake yourself off and everything is okay. We'll talk more about that in a minute, but there are some fairly major things that can happen from falls. Approximately 20 to 30% of people are going to suffer injuries that are pretty significant, including things like hip fractures, brain injuries, shoulder fractures, wrist fractures. Those can all be fairly catastrophic. Falls are the most common reason for brain injuries and broken bones in older adults. Even falls that don't cause significant injuries, just bruises or sprains, can limit mobility and result in some problems with your ability to continue to live by yourself. And then even more significantly for the people that don't fall, you know, the 70 to 80% of people that don't suffer significant injuries, it's very easy for them to develop a fear of falling again, which then results in them limiting what they do on an everyday basis, not going out, not socializing, not being active. And all of that has a huge impact on people's lives and can also lead to more falls. Falls not only impact the person that has fallen, but that person's caregivers and families. It can cause distress and concern and worry for the caregiver. It increases the workload for the caregiver and the vigilance, because now that caregiver is afraid that their loved one is going to fall again. So they're watching them walk, they're helping their walk, they're making sure they're not going places by themselves, and it just creates a big burden. And it can lead to social restriction for both the person that has fallen and the caregiver if they're afraid to go anywhere because the person may fall again. So the question, is it different? Are falls different for people that are living with dementia? And unfortunately, yes. People with dementia are around twice as likely to fall as people that don't have dementia. And those that do fall generally have an increased frequency of hospitalization because of injuries from the falls. And unfortunately, if they fall and fracture or have a significant injury, there's an increased risk of complications, generally from the hospitalization and from the immobility and ongoing care for those people in the hospital and at home again. So why is it different for people that are living with dementia? Well, we have to remember that although most of what people think about dementia is got to do with memory and cognition, but dementia is a disease of the entire brain. So it does have an impact on people's balance, their reaction time, some of the visual spatial parameters that they have. They can lose lack of insight into safety and when they need help. So not only is it a problem with memory and cognition, but there's some physical issues that arise from dementia as well. And so with that lack of insight into safety and the need for more assistance, it requires much more caregiver support and supervision, which can then lead down to that road of having people have more difficulty moving and moving less, which increases the risk of falling. So if we look at some of the risk factors for falls, because if we can identify risk factors and we can identify what might cause someone to fall, then we can help to possibly ameliorate some of them so that we can reduce that person's risk of falling. So on this slide, you see in the blue circles are the risk factors for falling for all adults. So muscle weakness can cause problems because you don't have the strength in your legs or in your trunk to support yourself. Foot problems like bunions or not feeling your feet. Heart problems, some people fall because their heart rate goes too low or they have strange rhythms and different things like that can cause you to fall. Unfortunately, the history of a previous fall puts you twice as likely to fall again. Vision problems, which we will talk about in more depth. Dizziness, which we'll talk about. Multiple medications, which we'll talk about as well. Difficulties with balance and walking. All of those are general risk factors for any adult. And then if we look for adults that are living with dementia, we can add on some more risk factors. Adults with dementia that are wandering or restless are going to be more likely to fall. Those that need assistance with their activities of daily living are going to be more likely to fall. And those that are having problems with their visual and spatial perception are going to be more likely to fall. So why is it that older adults are more likely to fall? Well, in general, people's eyesight and hearing tends to worsen with age. Reflexes aren't as fast. In general, muscles in the legs tend to get weaker with age. And obviously, we're all a little bit less flexible than normal. Our walking changes. Sometimes we don't have as much activity as we normally would, particularly here in the last year with COVID. That has had a huge impact on people's activity levels. And then we tend to have more medicines involved, and that can increase the risk of falling as well. So walking seems pretty simple. I mean, we do it all day. You start when you're 12 months old and you keep on going. It seems pretty simple. You just have to put one foot in front of the other and keep your balance while you do it. It's not as simple as it sounds. Yes, physically, that's what has to go on, but there's a lot more to it. You have to be paying attention to your environment. You have to be able to see what is coming in front of you, know if you need to step over or around, you're going to go through something, you have to duck down to miss something. All that's attention that you have to pay. You have to be able to have enough executive function to be able to analyze any risks that are coming your way and make a plan to avoid them. And then you have to be able to do two things at one time. Walk and talk, walk and look at something. All of that, although it sounds simple, is not as simple as it used to be for somebody that is living with dementia. So to be able to walk, you have to have enough strength in the muscles to be able to take those steps, enough flexibility in your joints. You have to have enough vision to be able to see what you're doing and to avoid any obstacles that are coming. In general, we say in the literature, it says that you have to have at least 20/50 vision for your vision to be able to help you with your balance when you walk. You can walk with worse vision than that, but to have better balance, 20/50 is what they're looking for. And then you have to have what is called adequate proprioception. So proprioception is a sense of being able to tell what position your joints are in without having to look at them. So you can bend your ankles up towards you, or you can straighten your knee or bend your knee, and you know whether your leg is bent or straight, or your foot is straight or bent without having to look at it. And not everybody has that sense. Some people that have neuropathies and other problems neurologically may lose that sense, and that affects their ability to walk. It requires balance and obviously control of your posture. If you can't stand up adequately straight, then you're going to have a hard time walking. So again, if we look at our risk factors, we've got all of these again, and I've added in a few here because now you see that we've added in depression, which in the research is connected with increased risk of fall, cognitive impairment, dizziness, and we added in incontinence because some people, you know, if they're in a hurry to get to the restroom, they may not be paying as much attention to safety as they should, and it can cause some significant problems. And then again, we added the environment, which we're going to talk about in much more depth. So then we talk about, those are some more of what we call the intrinsic risk factors. And here we're talking a little bit more about what's outside of you as a person that can cause you to fall. So there's taking more than 4 prescription medications, which I would say most older adults probably are. And then again, you know, the things that we all talk about causing falls: stairs, clutter on the floor, slipping on wet surfaces, loose rugs, tripping on cords, and more we're going to talk about. All right, so some of the medical conditions that can lead to problems with balance and falling: diabetes. So if you have any neuropathy or you have vision changes from diabetes, that's a problem. Arthritis, which changes your strength and your flexibility. Osteoporosis, different cardiovascular problems, other neurological diseases, and other acute illnesses like the flu or a stomach bug. Any of that would cause somebody to feel weaker and less strong. So if you add any of these medical conditions on top of some different forms of dementia or cognitive impairment, it's going to again further increase the risk of falling. So these are things that to be aware of, because the more you can treat these medical conditions and prevent complications from them, the least likely they are to impact your balance and risk for fall. Okay, so the first thing we wanted to talk about, or the one thing I wanted to get on the table first about falling, is something called postural hypotension. It's a very specific problem that happens when your blood pressure drops when you change positions, and it generally tends to happen when you've gone from lying to sitting or standing, or when you go from sitting to standing. And all of us have experienced something like this throughout our lives. When you say that you stood up too fast and you got real lightheaded and you saw little sparkles and stars for just a few seconds, that's what postural hypotension feels like. Unfortunately, in some people, your blood pressure can drop down enough that it can cause you to lose consciousness and faint, because the brain needs blood and oxygen to function. So it has a very strong self-protective mechanism in it, in that if it's not getting enough blood and it's not getting enough oxygen, its goal is to get it. So you can see in this little picture over to the right where the standing up person is white on the upper part of the body, that's where they're not getting blood. So the brain is going to want that person to get down flat so it can get the blood again. And the easiest way for that to happen is for you to be flat quickly. So losing your consciousness and falling will certainly do that. Unfortunately, it also leads to injuries. So some of the symptoms that you find with postural hypotension is when you change positions, feeling dizzy, lightheaded, or like you're about to faint. As I said, some people do actually get to the point of passing out or falling. Some people will talk about their vision is starting to close in and tunnel in. They may feel nauseous, hot, clammy, weak. All those are signs that their blood pressure might be running low and that they might be having postural hypotension. Tends to happen again if you stand up or sit up quickly, particularly if you have been in the morning first getting out of bed because you've been lying flat for so long, or after getting out of the car if you've been in the car for a while after a long ride. It can certainly happen if you stand up from the table after a large meal, or when you stand up after straining on the commode. And it tends to happen more often if you are dehydrated or if you've been sick. When you're dehydrated, it's basically because you don't have enough fluid in you and your blood pressure is already running a little bit low, and that can be a problem. If you or your loved one are having these symptoms, what should you do? Number one, talk to your doctor, because there are things they can do. They need to, double check, make sure that's what's going on. And usually they do that by taking your blood pressure, lying down and standing up to see if it changes. And then they will probably look at any of your medications to see if maybe it's a side effect of a medication. In the meantime, get out of bed slowly. We suggest that when you first get up onto the side of the bed, that you sit on the side of the bed for about a minute and then stand up. And before you walk away from the bed, stand still for about a minute. Same thing if you're sitting in a chair or getting out of the car, to stand still for about a minute before you start to walk. If you stop and are still for a minute, if you start to feel dizzy, you can always just sit back down. The other thing you can do is before you get out of bed or before you stand up, pump your ankles up and down like you're tapping your feet to music. Do that, 15, 20 times. It's going to start the blood flowing back towards your heart, and it will help a little bit with the dizziness. Do not walk if you feel dizzy, because if you're at the chair or at the bed, you can sit back down. If you're halfway across the room and you fall, that's a whole nother story. Make sure you're drinking the amount of water that your doctor has recommended so that you don't get dehydrated. Avoid very hot baths or showers, because that's going to open up all your blood vessels and tend to make the blood in your body go lower, which is going to make you more likely to have it. And then if it's a specific problem, when you first get out of bed in the morning, if you sleep on an extra pillow or two, it's not as drastic a change as from going flat down to sitting straight up. So those are some suggestions, but the biggest thing is make sure you're getting out of bed slowly, drink enough water, and then talk to your doctor about it. So the next thing we're going to turn to is talking about vision and falls. So we have 3 different sensations that we can use to help to determine what we need to do with our balance. The first one is vision, so that you can assess, what surface are you walking on, what's around you. The proprioception that we talked about earlier, the feeling in your feet so that you know what position your different joints are in. And then the last one is your inner ear, which helps to tell what position your head is in. So vision of the 3 is usually the one that we use most often for balance when we're walking on level ground. And as I said earlier, vision should be at least 20/50 if it's going to be able to help with your balance. It's important that you have your vision checked however often your physician or your ophthalmologist asks you to have it checked, and that you wear the most recent and the correct corrective lenses when you're moving around, so that your vision has the best opportunity to help you. So what I'm going to show you now is some of the different visual spatial deficits that people experience, so that you can get a feel for what other people may be seeing with these. So one thing that people have is they may have visual field deficits, is what they're called. This can happen after a stroke. It can happen in people that have different eye diseases and glaucoma and different things like that. So you can see the picture at the far left is what the normal vision is like. The other 2 pictures are showing you different field defects where those blotches you just don't see. So if you were walking and that's what you're seeing, you could easily miss some of the debris that's in the middle of the picture and cause yourself to trip and fall. And so, you know, if you were walking at home and there was a coffee table in one of those little blocks, you might not see it and you would could easily trip and fall over it. The other thing that's a fairly common problem is macular degeneration, which causes you to lose your central vision. So this is a picture of what it looks like to somebody that doesn't have central vision. So they have pretty decent vision around the periphery, but not in the center, which again can cause you to have difficulty recognizing obstacles and different issues that might arise when you're walking. For older adults with neurological impairment, Alzheimer's disease, Parkinson's, you will hear often that they have some problems with contrast sensitivity. So the picture on the left is normal contrast sensitivity. Picture on the right, you will see that you don't pick up the difference in the different objects and the colors as clearly as normally you would, which can lead to problems specifically with corners and doorways and steps, because you won't be able to see as clearly where one thing stops and another thing starts, which can make it easy to misstep and fall. And then if you go into that same concept, depth perception is another problem that's fairly common in people living with dementia. And this is a picture of a flight of steps. And you can see that you cannot tell where, after the first step, where any of the other steps are. So if you were standing at the top of those steps getting ready to go down them, you would pretty much not have a very good idea of where you need to put your foot, which would make it very easy to fall down those steps. So what can you do for somebody that is having problems with their vision or visual spatial issues? First and foremost, keep the environment well lit. At least that way, whatever they are able to see, they can see clearly because it's not dim or shadowed or dark. Using non-glare flooring is going to make it easier, and minimizing the busy pattern on floors and walls. Thankfully, we've gotten away in most homes from the very busy carpets that we used to have back in the 70s and the bright paisley flowered wallpaper. So that's not as big as a problem as it could be in the past. But having contrasting colors on around the door sills, the window sills, you know, at your baseboards, so that the wall is one color and the baseboard or the door jamb is all a different color, helps to be able to identify where the door is and where you're stepping through. Putting a contrasting color on the edge of the steps is going to help for those people that have contrast sensitivity and depth perception problems. And you can use non-skid duct tape on the edge of the steps, or you can use, they actually sell some corner pieces to go over the edge of the steps to help with that. At night, if you can close the curtains and the blinds so that you don't have that strange difference between the outside dark and the inside. And then just try to anticipate situations. If you know that depth perception and contrast sensitivity are a problem, and you're helping someone on steps or step down a curb, to be there and, you know, to say right in front of you, there's a step, you need to step up, or, you know, talk them through, there's another step, step down, so that they know what's coming. It's very helpful. Okay, so now turning to talking about memory and executive function and its role in fall prevention. So people living with dementia may be less able to do multiple tasks at one time, less able to plan and organize a movement. They may not be able to figure out exactly how to walk around the table and down the steps to get to where they need to go. So the easiest thing to do is try to develop as much routine as you can for day-to-day activities. Make sure the things that they need are close by, because if they can see their walker and their glasses right next to them, it hopefully will cue them to use their cane or their walker or their glasses and not have to think about, I left them at the bedside table last night, I have to go get them, and then that's going to lead them to walking without the things they need. And try as much as possible to do one thing at a time, because those dual tasking things are hard. So if somebody needs to talk to their loved one that's living with dementia and ask them a question, best if you can, just stop walking and ask the question, or ask it before they stand up, but try not to have them do too much thinking, planning, answering while they are walking. Okay, so back to talking about balance. We talked earlier about the senses that you need, the vision, the feeling in your feet, and the inner ear input. You also need the brain to be able to perceive what those different inputs are, to think about them, weight them, and then divide and conquer and develop a response and an action. You have to have the muscles and the joints available and strong enough to carry out the plan that your brain comes up with. How do you know someone's having a balance problem? Because it sometimes can be hard to tell. So one of the big things, if watch somebody when they're getting up to stand from sitting, and if they wobble or look like they don't want to let go of the chair, those kinds of cues are saying that they may be having problem getting their balance when they first stand up. People with balance problems tend to walk with their feet wider apart than is normal. It might just be a little bit wider apart, but then you can also see people walking with their feet significantly wider apart, like the old cowboys in the Westerns. That's a good sign they're having a balance problem. People with balance problems also tend to walk with much shorter steps because they don't want to have their feet off the floor any longer than possible. And then you'll see them reaching for the walls and wanting to be next to the wall, or holding your arm and not wanting to walk without holding on. Those are all clues that they might be having some problems with their balance. So what can you do to help somebody that's having balance problems? Make it easier for them to get up from a chair, and using firmer, higher chairs that have armrests are going to be easier to stand up from than the middle of the sofa, where it just sinks lower and lower and lower as you sit there and there's not anything to push up from. Same thing for the bed height. You want to pick a bed height that's not so low that they can't get up off the bed, or not so high that they have to use a stool to climb up on it or anything like that. Keep grab bars around the shower and around the commode to make it easier to get in or out. Keep rails on steps, shoes with non-skid soles. Encourage them to stand, because the more they can get up and exercise and practice moving in a safe way, the more they get to challenge their balance, which is going to make their balance better. Because much like a muscle, if your balance isn't doing well and you're not doing anything that's challenging your balance and giving you any exercise for it, your balance will get worse. That's something that physical therapy can help with. So certainly speak to your doctor about it, and they can decide if that's an appropriate referral to therapy. But we can certainly do things for balance. As far as footwear, shoes can have a huge role in preventing falls. You want to make sure that you're looking at people's shoes regularly, that they're not worn out or having, loose pieces that are going to make people trip and fall. Stay away from shoes that have the very, very thick soles. Although they are super comfortable, they also make it harder to pick up your feet enough to make sure you're not clearing over obstacles, particularly if you're not seeing, if you have spatial perceptions that we talked about earlier. It's going to give you more sole on your shoe that you have to clear. Using Velcro closures is going to obviously make it easier to get them on and off. Try to avoid walking in socks and slippers. The only time that would be an exception is if you've got on the socks with the non-skid on the bottom. Those are safe, but just straight up socks or slippers are generally slippery and a problem. And then make sure that the bottom of the shoes, the tread, is non-skid, non-slick. Although dress shoes are beautiful, they can slip and slide on those leather soles. And it's not written up here, but for the ladies, avoiding heels and having a closed back are good suggestions for shoes. So now we're going to turn to what can be done around the home. And interestingly, about 50% of falls occur in the living room and bedroom, which is, you know, when you ask people where they think most falls occur, I hear bathroom quite a lot, but living room and bedroom, clearly, because we spend more time there. 25% in the garage. In brainstorming on this one with other groups, the only thing we've been able to come up with is why so many in the garage would be because there are often, you know, a single step or steps, and then people are tending to do a lot of reaching and bending in the garage, getting things and getting in and out of the car. And then you see your bathroom, kitchen, and then steps, both inside and outside. So we're going to kind of go area by area here. So for your different pathways that you're walking, you want to try to make sure they are free of clutter and anything you can trip over. So we're talking cords, throw rugs, area rugs, books, pets, toys, anything you can trip over, furniture. You want to make sure that you repair any loose or buckling carpet, like over there in the picture on the right. That's real easy to trip over, that little buckle there. If there's broken tiles or anything uneven around, like on the sidewalks, make sure all those are cleared up. Get rid of your throw rugs and area rugs. If you absolutely cannot get rid of them, just make sure they have something underneath them that won't let them slip and slide. And if your loved one is tripping over them, then there are, I mean, you can actually tape down the corners of it to make sure they don't trip. And then try to arrange your furniture so that there are nice, clear, wide pathways and not a lot of going around things that are happening to get around the house. For steps and stairs, make sure there is a light switch at both the top and the bottom so that you can always put the light on before you go up or down the steps. You want fixed handrails on the steps that can support your weight, preferably on both sides, and have a contrasting color on the edge of the steps, again, for those with spatial perception problems. And don't have clutter on the steps. That's another big one. Okay, so for the living areas, you want to make sure you turn on a light before you enter a dark room. If that's a problem in remembering to do so, having motion sensitive lights that will come on when you walk in the room are a help. Get rid of all of the furniture that is on wheels. They are very unsafe. Try to either have no wax or at least a non-skid wax if you have to polish your floors. Again, the firm chairs with armrests. Keep a phone and a flashlight close by so that if the phone rings, you don't find someone getting up rushing to get to the phone. If the electricity goes out, you have something right there. And keep any walkers, canes, glasses, any other devices close to where you're sitting so that you don't have to find them before you go to get up. Same thing for the bedroom. Make sure your light or flashlight phone is in easy reach of the bed, that you either turn on a light or have night lights or motion sensitive night lights to light your path to the bathroom. You want to keep your clothing and anything else you use toiletry wise at chest or waist level, because I have definitely heard people telling me they fall in the closet reaching overhead to get something off of a shelf or to take something off their hanger. That's certainly a concern for falling. Make sure your bed height again is where you can easily get in and out. We talked about keeping your eyeglasses and everything close to the bed. And then the other thing is, if you look at the two pictures of the bedrooms, both of them, the one on the left more so than the one on the right, but your bed clothing is hanging all over the floor, and there's throw rugs on the one. So all those kinds of things you want to look at and try to remedy it so that that person getting out of bed and walking around the corner isn't going to trip on those blankets or that throw rug. Bathrooms. Make sure you've got either a non-skid mat or non-skid strips, or now they're actually installing tubs and showers with non-skid tiles in them, which is important. Keep the soap and the shampoo where you don't have to reach too far or overhead to get them. Having grab bars in the tub and shower, having a grab bar by the commode. When you use grab bars, it's important that they're installed correctly. And it's important that you have a grab bar that you can fit your hand around. So you'll find that there are different sizes and shapes of grab bars. So if you're going to go to the expense of getting grab bars put in, try them out, get one that's comfortable for your hand, and make sure that you have someone install them that knows how to do it so they can get it at the right angle and get it in the studs. The suction cup grab bars they are not helpful. They will eventually pull out, and when they do, they can cause you to fall. The other thing that you can do that helps quite a lot is get a tub or a shower bench, put it on in there, and get a handheld shower head so that you can just sit and use the handheld shower head to rinse and to wet yourself down, and it makes everything 100% safer because you're not standing there, you're not reaching, you're not closing your eyes in standing and running the risk of falling. And then for the mats that you put outside of your tub, because pretty much everybody does, just make sure they have the non-skid backing on them so that they won't slip and slide out from under you. In the kitchen, place things that you use most often where they're easy to reach, which is at waist level. You want to try to avoid reaching overhead or having to do a lot of bending when you're in the kitchen. Make sure that you wipe up the spills quickly. I have had people that have broken ankles from having ice cubes that fell on the floor melted. They walked around the next morning and slipped them. Same thing, I had somebody leave ice cream out on the counter and it melted, and when they came around the corner, they slipped and fell. So just be careful. And if you use mats on the floor in the kitchen, again, use those with non-skid backing. Okay, for medications, we do need to bring this up. There's not much that a physical therapist can do for this, but it's an important part of fall prevention. The research shows if you're taking 4 or more prescription medications, that is a risk for falling. Specific medicines can increase the risk of falling, particularly anything that makes you sleepy. So sleeping pills, allergy medicines that make you sleepy, anything that can cause you to feel extra sleepy can increase your risk of falling. Incorrectly using medications, taking them at the wrong time, a medication that your doctor tells you to take in the evening, maybe he's telling you to take it at the evening because he wants you to be sleeping when it gets its most effective because it might make you unstable or dizzy or sleepy. So if you take that in the morning and that sets in during the day, it could be a problem. Sometimes you don't get that information. You don't know when is the best. They just tell you to take it once a day. So not having enough instruction or information. So that's something you can talk to your doctor or your pharmacist about. And then some medications, side effects of making you lightheaded or off balance or dizzy can be a risk as well. So some of the medications that may increase risk of falling are some of the antipsychotic medications, some of the older antidepressants, benzodiazepines, which are things like Valium and some of the other tranquilizer sleeping kind of medications. Some of the high blood pressure medications can make you lightheaded, so that's why that's on there. Some of the anticonvulsions with our seizure medicines can make you lightheaded, which is why they're on there. And then opioids, the strong pain medications, can make you woozy and lightheaded and that's why they're on there. So what can you do? Make sure that you're taking your medication list with you to every healthcare provider that you visit. They should all be asking you what medicines you're taking. And if you have that list with you, you can make sure they have the most up-to-date information. That way, if they're going to prescribe you a new medication, they have what you are taking and they can assess whether or not what you're taking may interact with something they're going to prescribe. So carry that list of medications with you at all times if you can. Take your medications as they're prescribed. Don't take anybody else's medications, please. And know the side effects or the red flag symptoms from your medications. I know when I get a new medication from my pharmacist, they usually include that information with the prescription in print that is so small that it might take you an hour and a half to read it. So ask your doctor if they're giving you something new, what the side effects are or what symptoms you should be aware of. You can ask your pharmacist the same questions so you have that information before you start taking it. And then before you take any herbal or over-the-counter medications, consult with your physician or your pharmacist because they might actually interact with some of your prescription medications. So just make sure you check with them, okay? All right, then we're going to talk about exercise. Of course, with a physical therapist, you have to wind up with exercise. Exercising can help to prevent falls. It helps to reduce your fear of falling. It can improve the flexibility, the strength, your endurance that we talked about. It can improve your heart health. It can improve your balance. And as we talked about earlier, depression being a risk factor for falls, it actually helps to decrease depression. I know that I have a hard time exercising because it's generally not as much fun as other things you could be doing. So you have to kind of find some strategies to be successful when you start an exercise program. It's got to be something, an exercise that you're willing to do regularly and that you can keep doing. So if it's going to take a lot of special equipment or an excessive amount of time or too much money, those are all things that tend to make things not sustainable and something that could easily fail as an exercise program. Try to make sure that whatever exercise that you're doing includes some balance activities. You can exercise at home, you can exercise in the yard, you can go out and exercise. It does not matter where you exercise, it's all successful as long as you do it. And oftentimes having a partner in exercise helps. So if you're caregiving for somebody with dementia, if you're involved in the exercises with them, is going to be much more successful than expecting them to exercise for themselves. If you don't want to do that, then you can buddy them up with somebody else or go to, a program where they do that that's safe these days in COVID, which can be a little bit challenging to find. Some different examples of things that you could do. Walking is always an awesome exercise. You can walk inside, you can walk outside, but walking is a wonderful exercise that creates strength, endurance, balance. Tai Chi is a wonderful exercise. You can do that online. You can get videos and do videos with Tai Chi. Tai Chi is just an excellent, excellent overall exercise for balance and conditioning and coordination. We've got yoga, same thing. They have chair yoga, they have standing yoga, they have online yoga, they have video yoga, it's all kinds of different things. Dance. I know Vicki and Sunny were talking earlier about dance parties. Dance is an awesome exercise. Having the music going, having fun, it challenges your balance. It's an endurance exercise. It's a wonderful thing. Gardening is a good exercise. And then some of the classes, from the senior center, the brain body memory, the mindful movement, ageless grace, all of those are awesome exercises for balance and fall prevention. So what is it that you can do to decrease the risk of falls? First off, if you're concerned, talk to your doctor about falls risks and what you can do to prevent falls. Make sure you tell your doctor about any falls or any unsteadiness that you're noticing. If they don't know about it, they cannot help you to know about it. They should be asking, but we get busy and we ask, and sometimes you forget you're falling, or you don't feel like you're unsteady, but just bring it up and talk to them. Make sure you're exercising and moving. Have your vision checked regularly. Have your feet checked. If you haven't been to a podiatrist and you're having any problems with the feeling on your feet, or if you have bunions or anything, have somebody look at those for you, because unfortunately those feet are what holds you up. And having foot problems myself, it can certainly affect the way you walk. And then make your house safe. Walk through it. There are checklists that you can get from the CDC. It's in a place called STEADI, STEADI. On the CDC website has an awesome home safety checklist that you can walk around your house and just look through it and see if you find anything on there that needs to be changed. When a person falls, what should you do? Well, we have to look at every fall individually and try to figure out what happened. Where did they fall? Why did they fall? Is there something that we can do to reverse whatever happened that caused them to fall? Has the person's mobility changed? Are they not strong enough to walk with their cane anymore, and maybe they need a walker? Is the person looking more restless or fatigued? Is there something going on? Is the person in pain, and is that changing the way they're walking? Have the person's medications changed recently? I saw a gentleman this morning that started having problems with falling after he had his medications increased because his blood pressure had gone up so high. So they're looking into it now to see if perhaps there's any link between the medication change and his falls. And thank you. I'm here to answer any questions you may have.
Awesome. Thank you so much, Teresa. As before, as all day, if you have any questions, feel free to drop those in the Q&A portal, or you can drop them in the chat. As you all are doing that, I want to just really quickly, there were a couple really good comments in the chat. Lisa Granville said that it's good to take your medication in the containers to your doctor's appointment with you, because many patients leave off important information from their list, and the doctor might want to see who ordered the medication and when it was filled. So that's important to keep in mind. And then also David Wheeler mentioned the brain body balance classes at the senior center. So that's really great information to keep in mind. And I do see that we have our first question in the Q&A portal. Casey Callison says, what would you suggest if someone refuses to use assistive devices?
Well, if someone's refusing to use an assistive device, then the question aligns as to, why are they refusing to use the assistive device? Most often it's because they don't think that they need it. So then we have to look at, are there ways that we can convince that person that they do need them? Or is there an assistive device that they would be willing to use? So if you can kind of figure out what the reason is for refusing it and then try to work around it. Somebody might be refusing to use a walker, and that might be the best thing for them. But if they won't use it, maybe you can convince them to use a cane or a hiking stick. So sometimes if you can just figure out what exactly is going on and then find a workaround, or sometimes we can actually show somebody that they need it, or sometimes have a conversation. You've fallen 5 times and all 5 times you've fallen, you were not using your walker. Have you ever fallen with when you were using your walker and kind of try to reason it around, but that's a hard one.
Does anyone else have any questions for Dr. Ryan? Or wait, is it Dr. Hunter? I've been calling you Dr. Ryan.
It's Ryan.
Oh, okay. Well, I don't see any additional questions in the chat or in the Q&A portal. If you don't mind just hanging around for just a moment as I kind of prepare to close things out just a little bit. I want to remind you all that for those of you who are interested in getting CEUs for the conference, I'm going to drop a link in the chat box. You can just click that link. That'll take you to the request form for you to submit your request there. Please be mindful that towards the end of the questionnaire, there is another link that will take you to the Alzheimer's Project website for you to pay the $25 CEU fee. So, and this will go, it'll give us a couple weeks to get that information back out to you, but we will take care of that. Make sure that you submit the payment and submit the request. We will be cross-checking, so we will not be sending out the CEU certification until we have that, sorry, until we have that payment. All right, let me pin my thing. Okay. All right, so I've got that link in the comments for you, and I have I'm looking at a message that I got to share. I'll drop there's a link in here. There's a bit.ly link in here, and I will drop it in the comments to make it a little easier for you to access this. But there is a Take the People's Budget Challenge, and they are working to give residents the power to decide the state budget for themselves. And so what kind of leader would you be? So Take the People's Budget Challenge, and they will send your priorities to Tallahassee so the people can decide what our budget priorities are in the state of Florida, and it will only take a few seconds for you to play. So I will add that link in the comment section in just one moment. But before I turn things over to John to close us out, I want to say thank you again to each one of our presenters today. We appreciate each one of you for your service to the conference. I also want to say thank you to you attendees for hanging in there throughout the day. I know that being on Zoom all day can be a little bit tasking, so we appreciate you hanging in there with us for today. And I want to say a special thank you for, I want to say a special thank you to the sponsors, the conference sponsors, Charles A. Friel Foundation, Florida State University College of Medicine, the Leon County, as well as our session sponsors. For some reason, my mouse is not moving. Big Bend Hospice, Tallahassee Memorial Healthcare, Sense Evidence, Upslide, and then our supporting sponsors, Twyla Sketchley and Home Instead. I also want to personally say thank you to the Alzheimer's Project, to the entire team for allowing me the opportunity to serve as your virtual hostess for the day. It has truly been a pleasure. I have learned a great deal today. And so I think I got more out of it than you all did today. And I just really appreciate this opportunity. So like I said, I'm going to go ahead and drop that link for the People's Budget Challenge in the chat. And then I'm also going to share with you an upcoming event before I turn this over, I'm going to share my screen one more time. Give me 1 second here. All right, so we have Alzheimer's Project has an upcoming webinar called Prepared for Each Stage that will be taught by Summer Henderson, who is a social worker and the Alzheimer's Project community educator. Alzheimer's disease and other related dementia's progress over time, and based on a person's behavior, it can be difficult to tell what stage of dementia they are in. So in this webinar, you will learn all the stages of Alzheimer's disease and what to expect as a person progresses. And additionally, we will review the daily needs and routines suited for people in the different stages. So I will drop this. So I'm going to drop this link first in the chat. So if you're interested in that webinar, you can register here. And then I'm going to add in the People's Challenge, and I'll label the People's Challenge so that you know what it is. And with that, I'm going to turn things back over to John to share a little bit more about our door prizes, and we'll make that announcement, and then he will close us out. John, to you.
Thank you, Teresa, and thanks to all of you. You know, our mission at Alzheimer's Project is that we exist to provide comfort, support, and assistance to the persons with memory disorders and their caregivers in our area. Obviously, today was about supporting you, those caregivers, so that you can feel that sense of maybe relief, or the sense that somebody else is going through what you're going through, and that we're here to help. So I hope you'll call on us as needed. Remember our website, which will be, we're up in the process of updating it. So alzheimersproject.org, and keep an eye on that, because we'll have some a new look to us here in the next couple of weeks. But that's where you can find information about the class at Summer Henderson's going to be teaching here in the next couple of weeks. And of course, follow us on social media as well. You can find us at AP Tallahassee on our Facebook page, Alzheimer's Project Tallahassee, and we're on Twitter as well. So thank you to you all for being here. We really appreciate that. And as a little bit of a reward, you know, Teresa mentioned our sponsors. And I showed you before we went to lunch, we've got a couple of really neat giveaways. One's an activity book by Linwood Gasilia, who's a resident of the Villages in Central Florida there. We use a lot of the activities, and we think they'll be helpful to caregivers too. So winning the 4 books that we have to give away, Tammy Lewis, Carl Davis, Anthony Costa, and Nancy Gore. Congratulations to you all, and we'll make sure that we get those out in the mail to you as soon as we can. The fidget blankets, Twyla Sketchley, and thanks to her for being such a great supporter, handmade these, and there's some fabric in there that actually was fabric that her grandmother used to make the family clothes with, that goes back you know, into the early 1900s. It's a very special story, and Twyla is a great friend and offered these blankets up, and they're a great help. You know, just all of the things that come with something as, you know, simple as a blanket can really be of comfort to someone living with the disease. Manny Munoz wins one of those, as well as Kelly Davis. Again, we'll make sure we get those out to you as soon as we can, and thank you for being here. But again, you know, we're here for you. We can't do it without you. We can't do it without those supporters, like Teresa mentioned, the TMH Memory Disorders Clinic, Big Bend Hospice, St. Evidence K9, Upslide, Home Instead, and the law offices of Twyla Sketchley, Florida State University College of Medicine, Leon County, which provides us our funding through our CHSP grants, and the Fruoff Foundation, which also is a big supporter of ours as well. If you want more information, if you want to get involved in our organization, if you want to to volunteer or work with any of the projects that we work on, we're happy to have you. Like I said, you can give our office a call here at 386-2778. You can go to our website and participate that way. So I want to thank Teresa. I want to thank Stephanie Sitar for her work in getting all these great presenters together. The feedback I've gotten throughout the day is just so positive. So thanks to all of those folks. And with that, I think we're closed out. Teresa, you have anything else?
I'm going to drop one more time the link to request CEUs, just in case you missed it or it got buried in that. So make sure that if you are interested in getting CEUs for today's conference, make sure that you click that link and submit the request.
And I'd be remiss if I didn't thank Alex Kalpin, our behind the scenes, who put out the program for today, and who was helping pull a lot of this information together so that we can get it out and get it in the hands. And of course, she manages that social media that is so important to us as well. So keep an eye out on that. She does a great job with that. So that's all I have.
Thank you, everyone, for joining us, and have a wonderful weekend. Stay safe.